We've all seen those adorable pictures of children who have lost their baby teeth and they're waiting patiently for their adult tooth to come in. Well, did you know that doesn't always happen? Welcome to another episode of Ask Dr. J. The other day I had twins come in, a girl and a boy, both 11 years old, and they were missing multiple teeth. We discovered this by looking at their panoramic x-rays. Panoramic x-rays are a two-dimensional x-ray that show all the baby teeth and the adult teeth and what's happening. The girl was missing one and the boy was missing three. So that's 4 teeth between 2 twins that were not gonna come in. So let's talk about the factors that are involved. Number 1, I would have never known that the twins were missing teeth, and the parents and the twins wouldn't have known either if we had not taken proper imaging, which in this case was a panoramic x-ray that shows all the adult and baby teeth. So that's number 1. Without proper imaging, you can't diagnose this. And it would just be a surprise later on. And sometimes it's too late to really plan and do things if you don't have that information. So this is something really that at age 7 or 8, you really want to have this done to kind of determine what's happening and what's going on. And at that situation, this is when we found out for these twins at about 8 years old, and we sent them to the orthodontist for a consultation. Why? In these situations, the communication between the general dentist or restorative dentist, in this case myself, and the orthodontist who's going to be working the case has to be tightly knit. It's really important that the communication that takes place is precise and it's often, because these are kids that are growing and developing and changes are taking place. You have to have a plan of what you're gonna do in the future, and you have to be ready to adapt if something changes with your plan. So what are your options if you have any? In this case for the twins, the teeth that were missing were their second premolars. And in some cases, you can leave the baby tooth, let that grow in, and in other cases, they will start to resorb and basically they become damaged and you have to replace them. So this is the one conversation that we have with the orthodontist is what are our options and what are we gonna do? If you want to go the ideal option, then sometimes that would be removing the teeth and setting up a plan to have implants placed when the kids reach the appropriate age. What is that appropriate age? Well, for boys, it's about 18 to 20, and for girls, it's about 16 to 18. However, the only way to know is when the jaw has stopped growing and stabilized, even though there's always a little bit of growth and change occurring, but when it's stable enough that there's not going to be enough movement to change the position of the teeth. So we find that out with age, but also by taking cephalometric or side x-rays every 6 to 12 months to make sure that no more growth has happened. And that's how you can determine when the implant goes in. Mind you, that's in the future. Let's get back to right now when the teeth are missing. So for the twins, we sent them back to the orthodontist. I think they're about 11 and a half now when almost all of the adult teeth are in, enough to put brackets on and start moving things around. And our plan will be basically to get the teeth aligned, extract the baby tooth that is in the way of where the adult tooth is supposed to come in. Why? Because we're setting up for an optimal situation, and a baby tooth for a molar is wider than a premolar because it's holding enough space for the premolar to come in. So this is why communication between the restorative dentist, who's going to be the quarterback or the person that is directing the conversation with the orthodontist, is really important. So we know how much space to leave and where to place the roots so that in the future there's enough space for an implant to be placed. So the twins are going, they're going to be getting their braces, and they'll go through a course of maybe a year and a half or so until the teeth are right. I'll take the tooth out during this process. Now we're all done. 2 years later, we're done with braces. So what do we have to do now? Well, retention is really important. What's that mean? We've got to make sure that we maintain that position. And usually what we'll do, or the orthodontist will do, is make a retainer that goes in to hold the teeth, and where the missing tooth is, they'll add a tooth on there, so it adds basically an aesthetic component. A lot of teenagers wear retainers anyway, so it adds a tooth. Your peers may or may not know that that tooth is even missing, but it's key that that's there to hold that space so that when we reach those ages that the implant can be placed. So let's say that we've finished braces, the orthodontist has replaced the retainer with the replacement tooth for aesthetics, and maybe the twins are 14 or 15. Now we have to start to monitor growth. By the way, we also have to make sure we're keeping everything clean and going through hygiene, because we don't want to have cavities and things that can have the teeth shift and change, because that can also alter the plan. Now in this situation, we've got two twins, and they are going to have different times where they place the implant. Why? Because we discussed girls develop a little bit earlier than boys, so it's more likely that the sister is going to get her implant before the brother. So when we reach that age, now we go back, and it's important again that the restorative dentist coordinates with the orthodontist to make sure that once the implant goes in and there's a retainer that's made, because we have to keep retention after the new implant adult tooth goes in, it's really important that we maintain the position of the teeth before and also after the restorative or implant treatment is completed. So one more factor that I want to discuss is we know that people move around, especially here in the Northern Virginia, DC area. There's a lot of moving. And so what happens if you're in treatment, or maybe you're done with your braces and you've got the retainer, and the restorative dentist, or the quarterback, so to speak, is no longer the treating dentist because the patients have moved? Well, this is where it's really important that the two dentists get on the phone, get on a Zoom. It can't just be, let me go ahead and send you the patient on a letter, which happens a lot with kids for regular braces that are easier. It's really got to be a team coordinated effort. The two dentists have to work together to pass along information, and even get the orthodontist involved to make sure that the treatment is done properly. And in our case, we're taking 3D CBCT scans. If it's a front tooth, you may need to have bone grafting done if it never came in. So there's a lot of factors that are important, and that information has to be carried over, and it has to be discussed among all parties that are involved, since you're talking about someone from the age of 7 all the way to maybe 20. If I had to summarize this whole thing, there's a couple major points. First, early detection and proper imaging is critical. In our case, we took a panoramic x-ray. You can take a 3D CBCT. They both showed the same thing. But without that x-ray, none of us would have known that there was even a problem or a congenitally missing tooth. And remember, that panoramic x-ray, it shows the baby teeth on top, the adult teeth beneath, and the teeth that are moving through, and all the action that's occurring. So, and the same with the 3D CBCT scan. Without that, we would have never been able to find that problem. The second thing that's really, really important, and I've said it again and again, is the communication piece between the restorative dentist and the orthodontist and the parents, and if you move the other dentist, is critical. Because remember, this is not just a 12-month process. This is from age 7 to possibly age 20. So movement and things that are happening have to be tracked over time and properly discussed. Otherwise, the plan can be derailed, and you can have a result that is not fixable. So thanks everyone for sticking it through for the video. There's a lot of good information. If you have any questions about kids and implants or missing teeth, please feel free to leave a comment, and go ahead and like and subscribe if you got value from this video. This is Dr. J with Dental Masters of Alexandria.